The next documentary is about the healthcare system from three different countries: Switzerland, Panama, and Haiti. During the documentary, we are going to know different aspects about the healthcare system. Switzerland is a landlocked country located at the confluence of Western, Central, and Southern Europe. The country is a federal republic composed of 26 cantons, with federal authorities based in Bern. Swiss residents are required to buy health insurance from private insurance companies, which in turn are required to accept every applicant. The Swiss healthcare system is a combination of public subsidized private and totally private systems. In the public, we can find the University Hospital of Geneva. In the subsidized private, the home care service in case of a difficult pregnancy, illness, accident. In the totally private, we can find doctors in private practice and in private clinics. Health insurance is mandatory. This means that all citizens are obligated to contract one. If you don't, the government provides you with one abandon that you will have to pay for. The state gives a 3-month term to contract it. Most of the health insurance companies, when you contract it, charge you for those months that you didn't have insurance. Physicians or other providers of medical service may charge are clearly defined, either by collective bargaining agreement, health insurance company and service provider, the law, or a public authority. The system is funded through enrolled premiums, tax, social insurance contributions, and out-of-pocket payments. Children, adolescents, and young adults benefit from reduced health insurance premiums, but things change with your health insurance as you get older. Everyone has access to high-quality health care. Insurers are obligated to include everyone living in Switzerland in their basic health insurance without prior medical examination. In addition, Switzerland has a very high density of hospitals and doctors.
Panama. Panama is a country in a continuous development. Panama has a health system segment in two large organizations, the Ministry of Health, MINSA, and the Social Security Fund, CSS, which offer heterogeneous service coverage to the population based on a hospital-centric care model, focused on diseases and quite fragile. Panama's health profile is characterized by an epidemiological polarization, where communicable diseases are prevalent, especially in rural and poor population, while chronic degenerative disease typical of aging population gain importance. Despite a strong economic growth, Panama is plagued by huge economic inequalities that affect many children and adolescents, especially those living in rural areas and indigenous communities. Although progress has been made in children's rights, the situation of children and adolescents in Panama remains unstable.
Haiti, the first independent country in the Latin America and currently to the province in the riot. The hospital of the State Universities of Haiti is still not constructed following the disbanding 2010 earthquake. This planned 534 beds. In February, was said to become the new General Hospital, but the project has come to a halt at 25 million in still nearing for completion. The current political conflict is putting a start on access to healthcare in Haiti. In an attempt to force the Haitian president to resign, the country participates in a law conduct now has a paid law. Due to The locked patients were unable to travel to the hospital, and major shortages of medicinal supplies such as drugs and oxygen and correlate. Many services and resources available to Haiti. When disabilities confront international relations and non-profit organizations. Due to Haiti's political and economic instability combined with crippling natural disasters to the country relies heavily on international organizations to provide rehabilitation, healthcare, education, and disaster relief services. Haiti, the first independent country in the Latin America and currently to the province in the riot. The hospital of the State Universities of Haiti is still not constructed following the disbanding 2010 earthquake. This planet's 534th bed in February was said to become the new General Hospital.